Finally, Sheila Roberts of New Hope Clinic will join us to share a bit about the clinic services as well as their upcoming events. Sheila, welcome back to the show. It's been a while since I've seen you.
It has been. Thanks for having me here again.
You're quite welcome. Well, there may be some viewers out there who aren't familiar yet, but why don't you tell us a little bit about the New Hope Clinic?
I'd love to. That's why we're here. New Hope Clinic is an independent 501c3 nonprofit organization. We're not just a nonprofit organization, we're a clinic. We have 2 clinic locations, one in Boiling Spring Lakes and one in Charlotte, where we're providing medical, dental, and pharmacy services for low-income, uninsured adults.
And Sheila, what is your role at the clinic?
I am fortunate enough to be the executive director. I've been there almost 11 years.
Wow.
Yeah. It's a wonderful place to be. I get to make sure we try to have the right resources for our providers, it's a caring environment for our patients, and that our community knows about us.
Yes. So let's start at the beginning. Tell me about your mission and your history.
Well, the clinic was started because some local individuals, including doctors, realized that low-income uninsured adults were not able to access health care anywhere other than the emergency room. Unfortunately, that situation still exists. There are people falling through the cracks in our healthcare system who don't qualify for Medicare, Medicaid, or full VA medical, yet don't earn enough money to afford private health insurance or subsidies for health insurance. So it's a volunteer-driven organization. We have a small caring staff, but over 150 volunteers who keep us going.
Wow, that's some serious stuff. I think that last year you celebrated your 20th anniversary, is that correct?
We did. 20 years of caring.
20 years of caring.
Yeah, we rolled out a new logo, which hopefully represents what we're really doing.
And it's a nice logo, I like that.
Yeah, we're working together. It's not just about the doctor in the exam room, we're working together with our patients, our community partners, all for that lofty goal of a healthier community for everyone.
That's awesome. Well, I know that you have a couple events coming up, so let's talk about those. I think the first one is Go Jump in the Lake.
Yeah, are you ready?
I am.
Okay. Are you gonna jump this year?
No. That'd be a no, Sheila.
Yeah, we've been partnering with the Southport Rotary Club. This will be the 11th annual Go Jump in the Lake. It's a 5K run walk and a 1.5 mile fun run. They both start and end at Spring Lake Park in Boiling Spring Lakes. It's the Saturday of Labor Day weekend.
It's always that Saturday, right?
It is this year. That's August 31st. We start at 9 a.m. So it's a great opportunity to get everyone out and moving. 5K, there's some Couch to 5K programs, or Walk It, or Walk the 1.5 mile. We are always trying to create opportunities for wellness in our community. So this is another great partnership with the Southport Rotary, get people out moving, and even if you're not the fastest person, there might be a chance for a prize. The finish line is right at the edge of Spring Lake. And yes, there is water in the lake. There's water in the lake. We always get that question. Boiling Spring Lakes was hit hard last year.
Very hard during Florence.
Yeah, so we had to rearrange some things for this event, but there is water there and our finish line will still be right at the edge of it. So we give out a prize for the best splash for an adult and for a child. So that's trying to create a fun atmosphere. It's not just about sweating and running around. But
that's a good weekend to have it.
Yeah. We have some great sponsors, including Novant, thank you, for the event. And they'll set up there so you can learn more about the community that way and working together with our healthcare partners.
Yeah. I know that you partner with several people in our community, and I understand that you have partnership, as Novant does, with the Brunswick Wellness Coalition.
Yes.
Tell me a little bit about that.
So the coalition has been growing over the last couple of years, working to make Brunswick County the healthiest county in North Carolina.
Go!
Absolutely.
Go Brunswick County.
It's looking beyond healthcare. It's looking at wellness. So we have a lot of healthcare partners, but also community organizations like food pantries, looking at housing, ways to bring wellness to our entire community, address some disparities.
Yeah, I noticed they had a walk with a doc for the last 2 months, and so hopefully that'll take off too.
Yeah, we started that. It's the second Saturday of each month at the Boiling Spring Lakes Community Center. A healthcare professional, we have a short walk and then goes out and walks with anyone who shows up. You get a t-shirt. If you come 3 times, you get a pedometer, and we're hoping to replicate that in other areas of the county. We also are doing a healthy giving campaign with the food pantries. We want to make sure that we're not just feeding bellies, but we're providing nutrition.
Right.
So looking at ways to work with churches as well to bring good food for those church dinners and just create a whole culture of wellness.
I notice when people donate food, sometimes they donate a lot of pasta, things like that, macaroni and cheese, and we have to figure out better ways of donating healthier options.
Right.
So.
We have high occurrences of obesity
Right.
and diabetes in our community, and it's growing.
Right.
So healthier food options and access to exercise that's affordable and safe is very important for us.
Yeah.
So that helps our patients as well as everyone.
That's right. It helps everybody.
Yeah.
So we've talked with about Go Jump in the Lake. So how about the next one that's coming up later in the fall? I think it's Art with Heart.
Yep, we hold Art with Heart every other year.
Right.
We have a great artist community locally.
We do.
So we have paintings, sculptures, pottery that are donated to our organization, as well as some other items like golf packages, wine packages, and gift certificates. We'll be holding that on Sunday, October 20th at the Southport Community Building.
Oh, that's good.
So there's a lot of details about that, as well as Go Jump in the Lake on our website. Both of the events are successful because of our sponsorships and the donations that come in.
Yeah.
That's how we keep the clinic going.
I know.
We are not federally funded organization. We get our funding from donations and grants and these fundraisers. So.
I know. Novant Health is proud to be a sponsor of both events, and we're proud to help out as much as we can with your patients. And I know that you guys appreciate that, as well as several other facilities around help you in terms of services and.
That's right.
And testing and what have you. So
we all do that together. We can't do everything for those without insurance in our community, but by working together, we can do a lot more. And our patients are so appreciative too. It's wonderful to be in a place where people say thank you, and you know you're making a difference.
Yeah. And all of the proceeds from your events raised goes to help the patients at New Hope Clinic. It goes to keep supporting their all the care that they're getting and medications and stuff like that.
Yeah, we have this great team of volunteers from our doctors, our dentists, our pharmacists, our nurses, our receptionists. We have people who do data entry. And you know we can always use more volunteers.
That's right.
That's right. But we do need funds. We still have to pay an electric bill. We still have to follow all the same laws as the healthcare organization. We need to keep the building safe, providing medications. So we do.
Well, let's talk a little bit about the types of patients that primarily are served at New Hope Clinic. What do you see?
We see everyone. You don't know when someone is going to have a hard time in life. So it's our working poor in our community, people who may be holding down a couple jobs, caring for another family member, someone who's out of work short-term or long-term. Their health care often can make it difficult to hold down a job. So we try to keep people healthy enough so they can work when jobs are available, and to keep the emergency rooms open for true emergencies.
True. And we appreciate that.
Yeah, absolutely. Well, we all do. We need to be able to know that when you're urgently ill, you can go to the emergency room.
Exactly.
So
that's what it's for.
We're trying to help get more people to learn about New Hope Clinic, to know that go there. It's like a primary care doctor's office with some limitations, but we're trying to provide a caring environment, and it's great. Our staff, our volunteers are there because they care. They can spend more time with a patient who maybe hasn't been able to access health care in quite a while, to understand not just their health care needs, but their community needs. That's where some of those other partnerships come in with the housing and the food access, to provide connections to resources to get back on your feet.
All right. Yeah. Is any payment required at New Hope Clinic?
No. The services in our building are available free of charge, and we try to work with other healthcare organizations that will also see the patients for free or for a reduced cost. But a patient does need to qualify first.
Okay.
They come in either in person, or all of our forms are on our website, so they could fill those in and then submit those, and we can talk over the phone about the process. Someone must be a Brunswick County resident, an adult with no health insurance, and low or no income. So we'll need some documents to prove that, so that we can open up those doors to health care.
So how easy is it to start that process? What if there's a viewer out there who thinks, they're a candidate for this, how do they go about that?
I encourage them to call us.
Okay.
The main phone number goes to our Boiling Spring Lakes location, and that helps both sites, and we can talk someone through that. There's also a section on our website for patients that talks through the application process as well as the documents that we will need to be able to get those appointments scheduled.
Okay. And can you give us the phone number at the clinic?
Yep. The best way to call is 910-845-5333.
5333.
5333. Yep.
How about volunteers? Do you need volunteers?
We do. We do. We especially need volunteers to help check the patients in for the appointments. We need people to help speak to the community, maybe do an interview with you sometime, to go as well as in our pharmacy, pharmacists. So whether you have a healthcare background or not, we find a way for someone who has a good heart, can pay attention to details. We'd love to have their help.
Great. And they can inquire about that by calling the 845-5333.
You got it. Or go on our website. There's a section on there for how to help, either by volunteering or by donating.
Awesome.
We do.
Well, it's been a pleasure, as always, to have you, and I look forward to both events. I'm excited. I'll be at both, hopefully. Maybe not in the water, but I'll be there.
That's right. Well, we just want to make sure as many people as possible know about our services. If they're not able to access medical, dental, or pharmacy services, to contact the clinic. We might not be the right answer, but we'll try to get someone connected, and these events help us further that mission.
Right. Well, thanks again for being here. I look forward to seeing you soon.
Thank you, June. Great to be here.